The Alliance and Integration Management team is part of business development operations. We work closely with the transaction team when we're executing a deal to contribute to the contracts, but we are also tasked with ensuring that we manage the deals once they've been signed, and we ensure that we deliver on the obligations that we've signed up to.
So whether it's an acquisition or a divestment, we're involved in the transition of the asset from AstraZeneca to the partner, or from the partner to AstraZeneca. If it's a longer-term co-development collaboration, we're there to support the collaboration throughout its life cycle.
We add value to a partnership in a number of ways. We help a partner navigate the complex system of AstraZeneca. We're here to smooth the passage of the relationship by being a first point of contact to help resolve any issues that come about through changing circumstances, and ensuring that those issues don't become disputes that then derail from the objective of delivering the collaboration.
Alliance and Integration Management actually adds value long before the contract's signed. We're involved from the very beginning, from due diligence through negotiations and contracting. We use our time during that period to evaluate and think about the cultural, strategic, and operational similarities and differences between AstraZeneca and our partner. And we use that information to build in the most effective governance, decision-making, and dispute resolution processes into the contract so that that collaboration can be as effective and efficient as possible. There are three common types of risks in partnerships. There are the human risks, and those are the risks that just have to do with having people work together with different styles and approaches. There's the business risk, and those are the risks that are inherent in the drug discovery process, the drug development process. And finally, there are legal risks. No matter how careful you are in designing a contract, there will be things that are unforeseen that need to be changed, evolved through amendments in the contracts and so forth. Due to the long-term nature of many of our partnerships, companies tend to evolve and change over the life cycle of a partnership. Company strategies change, employees turnover, company priorities change, and so for us, we need to be flexible in revisiting those priorities with a partnership. When we enter into a new partnership, we want to make sure that our partners are transparent with us and challenge the way we do things. We're not only partnering with you because of your outstanding science or your innovation, but we want to learn from you as well. We want to learn to be more entrepreneurial.
We like a partner to be as flexible and pragmatic as possible, and we try to do the same in return. So what we can do is try and work through any difficulties and find a resolution in the most creative way possible. When you enter into a partnership with AstraZeneca, one of the key things to remember is that we want to engage in a long-term relationship, and we want that to be as productive and collaborative as possible. So it's crucial that you're very open and honest with us about any difficulties or challenges you're facing in your organisation, so that we can work together in a flexible way to try and work through any difficulties and overcome those issues.
One of the things that the Alliance and Integration Management Group will do, we'll listen to the way that you approach problems, and hopefully we can come to an approach that's best for both companies.